Levodopa is a generic name. It has brand names like Dopar, Larodopa, and L-Dopa. Its chemical name is C9H11NO4. Levodopa is an anti-Parkinson agent and its pharmacologic is dopamine agonist. The pregnancy category is C. Let's proceed to the mechanism of action. Levodopa, by various routes, crosses the blood-brain barrier, is decarboxylated to form dopamine. Let's move on to the pharmacokinetics. Levodopa is rapidly absorbed from the GI tract. It is distributed into breast milk with protein binding 10 to 30%. It is metabolized in the gut, liver, and kidney, and excreted via urine within 24 hours. At this point, let's talk about indications. Dopaminergics are indicated for the relief of the signs and symptoms of idiopathic Parkinson's disease. Levodopa is the drug of choice and acts as replacement therapy, while amantadine is an antiviral drug that increases release of dopamine, and apomorphine directly binds with postsynaptic dopamine receptors. Contraindications. Contraindications of levodopa are as follows: allergy to dopaminergics, angle closure glaucoma, lactation and pregnancy, suspicious skin lesions, cardiovascular disease, bronchial asthma, and psychiatric disorders, hepatorenal disease, and lastly, apomorphine, which apomorphine can increase risk of hypotension and prolonged QT interval. Let's proceed to the side and adverse effects per body system. In CNS, anxiety, nervousness, headaches are common. In CV, arrhythmias, hypotension, and palpitation are common. In respiratory, bizarre breathing patterns should be monitored. In gastrointestinal, anorexia, nausea, and vomiting. In urinary retention and others, monitor flushing, increased sweating, and hot flushes. Lastly, let's proceed to the nursing responsibilities. These are the things the nurse must consider while giving the drug. Before, the nurse must assess history of hypersensitivity to levodopa, and physical aspect must be considered, including the weight, the patient's skin color, and any signs of lesions. When giving the drug, during giving the medication, the nurse must ensure that the patient's void before receiving dose. The nurse must monitor hepatic, renal, and cardiovascular function. While after The patients have taken the medication. The drug must be taken exactly as prescribed. Educate the patients that the patient must experience side effects like drowsiness, dizziness, and confusion. The nurse must instruct the patient to report fainting, lightheadedness, and dizziness. And we're done. That's all about Levodopa. And I'm glad that you listened, and I hope that you learned something. Thank you and God bless.